Hello and welcome to the Scholar Circle, scholarcircle.org. I'm Maria Armoudian. Brazil is the largest country in South America with the highest GDP, a huge population, large urban centers, and a deep divide between rich and poor. Its response to the coronavirus has implications not only for the country itself, but also for the region and the world. Contributing host Doug Becker examines the policies and actions of the Bolsonaro regime, the complexities of Brazilian federalism, and the state of the nation in the pandemic.
Brazil is the largest nation in South America with the highest GDP, high rates of urbanization, and deep divisions between rich and poor. It also has a complex federalist government structure not that dissimilar to the United States. In today's show, we will examine how the Brazilian government has been confronting the COVID-19 pandemic. We will focus on the breadth of the threat, the relationship between the federal government in Brasilia and the states, and a report card on the policies of Brazilian President Jair Bolsonaro. Our guest today is Erica Resende, Assistant Professor of International Relations and Security Studies at the Brazilian War College in Rio de Janeiro, Brazil. She is co-editor of Memory and Trauma in International Relations, Theories, Cases, and Debates, and Crisis and Change in Post-Cold War Global Politics. So Erica, first, how significant has the COVID-19 pandemic been in Brazil?
Well, first of all, I think it's important to note that Brazil has been already struggling through both an economic crisis and a political one. And when the COVID pandemic came up, I think it's very safe to say that once again, we have to acknowledge how even such a grave problem as a pandemic is limited to the logics of politics. Because the coronavirus crisis is being subjected to the logic of politics, and specifically here in Brazil, the politics of populism. How populism is looking to the current situation, you could actually understand, and it points out very interesting developments where you can pinpoint how much of the case that is able to do to make an argument for Bolsonaro as a populist leader. And so you can see very well being played the anti-elitist, anti-pluralist approach to populism. You could also see how something as meaningful and grave and severe as the current pandemic is being treated and framed as only one aspect of something that is happening, a crisis, but still subjected to the logics of we versus them, of antagonism, of polarization within Brazil politics.
In discussing Brazilian politics, at this point, there's no figure in Brazil that is more significant, that casts a larger shadow over political decisions made than the president, Jair Bolsonaro. Can you give us a bit of a description? You referenced that he's populist. What exactly is populism meant? And can you describe, prior to the pandemic, what his presidency has been like?
Jair Bolsonaro got elected in late 2018, and so he came into office January 1st, 2019. His election is easily explained more from circumstantial structures and problems emerging from the so-called car wash procedures. It's what happened when the presidency of both President Lula da Silva and Dilma Rousseff was impeached. And all the federal investigations that had to do with corruption and money being distributed to congressmen to give support to both Lula and Dilma political agenda. So the shock of the revelations, the trials that prolonged for almost 1.5 years, that left a very stark, a very bad taste for Brazilian people. So the political campaign for presidency was pretty much centered on a vote against the PT party, the Labor Party, which had traditionally been in opposition in Brazil, but came into power and was able to elect I feel 2 terms for Lula, 1 term and a half for Dilma. So it was a reaction or a backslash against that was perceived as a very progressive agenda. At the same time, a little bit because of the 2008 economic crisis that originated in the US and Europe, but with a backslash and took a little while to arrive in Brazil. And so starting 2010, 11, things in Brazilian economy went south. So it was a mix of resentment and the shocking news and the trauma for PT that had always had a very high ethical and progressive agenda. How could they been meddled with such a big scandalous corruption affair? And also lots of resentment from conservative groups from the right that traditionally have been a little more mute in Brazil, but all of a sudden through social media like Facebook, WhatsApp, and Instagram, all that came out with a vengeance. So there was some way, in a way you could explain the election of Jair Bolsonaro as him previously someone that had not occupied, say, the central stage in Brazilian federal politics, but all of a sudden he began to represent all that anger, resentment that came out very strongly against anything that could be associated with the left. So Bolsonaro was elected, but the support, and I have to say this, the Brazilian national elections of 2018 have a very high no turn up in the booths. So about 20% of people did not show up, or if they did show, and they canceled their vote. So those two factors, specific of that time of resentment and challenging through Bolsonaro, as well as this high allowed Bolsonaro to be elected. He was elected from a very weak party. Brazil has a plural political party system. His political party was what we in political science we call it party for hire. If you have money that you want to put in it, or someone that in the last 2 years became popular, you will be sought after by those small political parties. So a political party.
And that's actually fairly common for Brazil, right? That the left has a pretty well-entrenched political party, the PT or the Labor Party, but most Brazilian political parties are actually fairly weak.
Yeah, fairly weak, with no specific agenda or identity, very ideologically weak, empty. So his political party, once he got elected, he did not have majority in the houses. PT still holds the majority in Congress, for example. So since he came into the office, he has been very aggressive towards what he calls old politics or traditional politics, refusing to negotiate with Congress and the Senate, refusing to play, for so to speak, the democratic game of bargaining and trying to reach consensus. So a very aggressive, more like belligerent attitude regarding the democratic institutions like the Supreme Court, the judiciary branch, any institutions that traditionally would hold the presidency or anyone from the branches accountable. And also the way to be able to characterize Bolsonaro as a populist leader, Populist has come back with a vengeance, not only to Brazilian politics, but all over. You have examples of that, both from the right and from the left. Be in Europe, in very traditional democratic, liberal democracies, as well as more late democracies models. So even if you look into, there are like 4 or 5 different definitions of populist, but if you take those characteristics and look into Bolsonaro case, you will easily make the argument, and he is fulfilling the criteria. The one that I like to apply in his case is the idea of a populist leader presenting himself as the sole and unique representative of the people's will, as only himself is the true representative, and being able to understand what does the people needs and express and make those needs and turn into reality. Also, all the time, in order for the populist regime to maintain or to gain and maintain support, engaging in a constant conflict-driven discourse, and a discourse that it's against institutions, against democracy itself, against anything or any actor that could be understood as representative of the elites, represents. So in this package of the elites that would be against the will of the people, the elites being scientists, politicians, economic elites, economic agents. So that explains a lot of how very aggressively has been against scientists that are now articulating Brazilian, or trying to articulate and put forward Brazilian policy to fight the COVID. And also very anti-pluralist. So he has a public discourse against LGBT rights, against African Brazilians, against any kind of minority, and very white Christian, male, patriarchal, heterosexual stances, and condemning any kind of minority.
So you're describing kind of a personalistic politics, some antipathy towards science, some unwillingness to compromise, and some deep divisions within the different branches of government. And the view from up north here in the United States, there is certainly some similarities.
Lots.
You're listening to Scholar Circle, scholarcircle.org. Our guest today is Erica Resende of the Brazilian War College. So at this point, let's talk about the pandemic. How bad has it been in Brazil? Is Brazil suffering the number of cases and the number of fatalities that other countries, that when we usually think of the countries that have been hit the hardest, obviously the United States and Italy and China, etc. Should Brazil be on that list of countries that have been hit particularly hard?
We don't know. And the reasons we don't know, because data is very, very weak. And when I say data, Brazil has been suffering acute problem of lack of mass testing. So our numbers are not solid. Our numbers are not credible. So whenever the Minister of Health goes into every day, it used to be, was the Ministry of Health is releasing numbers day by day, how many more infected people in which cities, how many deaths in the last 24 hours and all that. But those numbers, they surely suffer from subnotification. That is, there are not enough tests to actually be able to tell how many deaths are due to COVID, how many people are actually infected. So you have experts saying that the official numbers should be multiplied by 10, by 12, by 15, or even 50. So it's anyone's guess. But one thing that I want to make also clear for the audience, and especially an American audience, that unlike the US, and I think, and also it's interesting to try to establish a comparison, but with some care. We are a continental country as well as the US. We have a federal system as well as the US. There's the current, so to speak, similarities, as you mentioned, between Trump and Bolsonaro, yes. But we have one thing that we should try to put in at center stage. Unlike the US, we have a universal healthcare system. This universal healthcare system it's very alike the ones you find in Europe, especially NHS in the UK. So it means that whether you are employed or not, if you're young or old, if you're black or white, from the north or the south, no matter, because you're a citizen, you are entitled to public health care. And our healthcare system is the one that exists of over 60 years or so. So it's nothing new. It has always been there since the 1930s and perfected in the 50s. It sustained the military rule, came back renewed and with much more grasp and more capillary and more autonomy after our redemocratization. And it's this healthcare system where traditionally all kinds of national campaigns for vaccination, smallpox, and whenever people actually need, and it's because of this, it has a very deep web system that is able to penetrate to the farthest reaches of the country. It is the national public health service that is there now fighting the good fight. So it's a system that has most of intensive care units with the ventilators that are so much and now important. So today, even if you do have, I myself, for example, I have my own private health insurance coverage. But if I do get sick, if I do get, I hope not, infected, there's 70% chance that I'm going to be treated in the public system. Because the private hospitals, they lack not only some of the infrastructure, as well as this kind of epidemiology is usually conducted in the public system.
Is Brazil under stay-at-home orders nationally? Are there certain states? Are there certain cities? And if or if not, who's making the decision as to whether or not there's shelter-in-place types of orders across Brazil?
So now things are really interesting from a political science point of view, not for those who are actually getting sick. Bolsonaro, typically as a populist leader, is always trying to create crisis. And by the creation and the polarization, he's able to wake up and keep very politically active his supporters, especially on social media. So in a way, even before the pandemics, every once in a week or every 2 weeks, something happens in Brazil, something that he says or something that he offends, and charges and with no proof or no evidence, something always happens that the polarization is always kept on. So it's an ongoing, prolonged crisis, him against political parties or whoever is the enemy of the jour, of the day. So, and when the pandemics was announced by the World Health Organization, it was in March 11, immediately, again, anti-science, this is nothing, that's the official policy, or more to say, officially there was a lack of national policy. As a result, at subnational level, cities, municipalities, and states, those are the actors that began to work a response. So the first wave of responses were led by the governors of both Rio de Janeiro state and São Paulo state, and then followed very close by other governors and some mayors of big cities, Rio, São Paulo, the big cities, and starting mobilizing and working up plans of hospitals that were supposed to be the welcoming hub unit for those where you should go, what you should do. So they lack the federal, so to speak, competence to shut down and decree quarantine, lockdown. But within their subnational competence and within the federal law, they were able, for example, to suspend trading business and shut down or try to slow down. Therefore, the first response was isolation at home, especially elderly, shutting down schools, shutting down non-essential businesses. All those initiatives were decided at state and city level. Almost immediately, Bolsonaro reacted, and from how it has been played out, his reaction was very stark and very directed towards the governors of Rio and São Paulo, whom Bolsonaro sees as potential rivals for the 2020 campaign for presidency. So his reaction was to downplay the virus, downplay COVID, try to reassert that those decisions are only able to be done by the federal government and not at the state level. A week later, the Supreme Court confirmed that both cities and states did have power to decide on isolation and social distancing and take any measures they saw fit. So the next step, what Bolsonaro did, was to take the polarization against his rivals more broadly, and the framing of the current pandemic response was, this is going to kill the economy. Mm-hmm. So one thing that's very interesting is how, which is very now similar to the U.S., the case in the Trump, is a discourse of placing a trade-off between lives and economy. Yeah, we're going to save a few lives, but we'll ruin the economy. There will be more people unemployed and blah, blah, blah. So in the last month and a half, we've been officially isolation by the states and practicing social distancing for about a little more than 45 days. And at the national level, this is going to hurt the economy. And almost daily, be it the governors or city officials, they organize a press conference to release the more recent data on deaths and how many intensive care units are available, what is the standard. And following that, immediately, Bolsonaro goes into Twitter or whatever and starts criticizing and downplaying the virus. And this reached almost epic proportions when about 2 weeks ago, again, polls came out indicating that the Minister of Health, appointed by Bolsonaro, and up until late February was someone that basically no one took any notice, but he was a doctor by trade. And he started a very serious approach of, first of all, during pandemics, we need to have transparency, and we need to have one single coherent voice in terms of policy. So once again, daily, going press conference, releasing data, talking about the need for social distancing, isolations, and things like that. And a poll came out placing the Minister of Health, his last name is Mandetta, with approving rates of approximately 86% against 42% of Bolsonaro. And almost immediately reacted because starting to perceive Mandetta as a possible opponent as well. So Brazil suffered through 2 weeks of intense friction. We have a word in Portuguese to describe this process. It's called deep fry. When a politician, he wants to get rid of someone, but on the formal firing would be very high cost, a political cost. So a process of deep fry, trying daily to undermine, to downplay whatever this official says. So the Minister of Health went through 2 weeks of deep fry in open public, to make it so that the situation was so unlivable, impossible, that he would ask to resign. And then there was one magnificent quote by him when asked by a reporter in a press conference if he was going to resign, saying, "I'm first a doctor. A doctor does not abandon its patient." 3 hours later, Bolsonaro tweeted, "Yeah, but a patient is able to ask for another doctor, so I'm going to fire you." And he was fired the next day.
Okay.
So,
what's striking about this, about what you have just described, is it sure sounds like what Brazil is rather similar to the U.S., but Bolsonaro is known as the Trump of the tropics up here in the U.S. I want to thank you for your updates, and certainly something that we're going to be watching. So perhaps we can learn from Brazil's experience, and certainly because of the role that the pandemic is playing in political issues. So thank you very much, Erica Resende.
Welcome. And anytime you want to have a chat, you know how to reach me. Stay healthy, stay at home.
So we discussed the current status of the COVID-19 pandemic in Brazil with Erica Resende. She is an assistant professor of international relations and security studies at the Brazilian War College in Rio de Janeiro, Brazil. She is the co-editor of Memory and Trauma in International Relations, Theories, Cases, and Debates, and Crisis and Change in Post-Cold War Global Politics. Thank you very much.